Hi everyone, my name is Dr. Gayatri. I'm a GP in the NHS and a functional medicine doctor. Today I thought I would talk to you all about post-viral fatigue, mainly because of the recent pandemic, which has affected so many of us in all sorts of ways. But for those of you that actually did suffer with COVID, I wanted to do this video to increase the awareness of what we are now referring to as post-COVID-19 syndrome, which is where some of these COVID-affected patients have gone on to develop a severe post-viral syndrome, which is a long-term state of chronic fatigue. Now, fatigue is a common symptom of many different infections. It's just the normal part, really, of the body's response to fighting an infection. And usually that fatigue goes away pretty quickly once the body has dealt with that infection. But post-viral fatigue is when this fatigue that started with the viral infection continues for a much longer period of time, well after that infection has fully settled. So now fatigue can be really difficult to describe for some patients. People who do experience this fatigue, severe fatigue, will describe a feeling of complete physical and mental exhaustion, which is different from everyday tiredness, which everybody experiences from time to time. Recovery after activity changes, so that rest and sleep isn't refreshing anymore. And fatigue can really impact every part of life, including school, work, home life, social activities, sports, and even relationships. So post-viral affects people of all ages, including children, young people and adults. And the severity and the length of time that someone experiences this fatigue doesn't necessarily always reflect the severity of the initial infection or their previous fitness levels even. So some people can be very unwell at the start of the illness but recover relatively quickly, whilst other people may have only mild viral illness, but then they go on to develop this debilitating fatigue for a long time afterwards. So as you're all well aware, there's been a large number of people who have suffered with COVID, and a number of these people have continued to suffer. Once this acute COVID infection those symptoms have settled, these patients have gone on to experience long-term adverse effects resembling pretty much CFS-ME type of symptoms, like persistent fatigue, diffuse myalgia, depressive symptoms, and non-restorative sleep. This kind of post-viral syndrome was previously reported and seen following SARS, which of course also was a coronavirus. So after this acute SARS episode, some of the patients, many of which were healthcare workers, they went on to develop this chronic fatigue-like syndrome, which pretty much prevented them from going back to work for almost 20 months after they were initially infected. So whilst there isn't any current specific vaccine or successful treatments for COVID-19, there are promising preventative approaches and therapeutic, nutraceutical and botanical interventions. So we as functional medicine doctors are the best trained professionals to address the needs of these asymptomatic patients or symptomatic COVID patients prior to any potential hospitalisation, and also of course we're particularly qualified to support the majority of those who have been infected by or even seeking to avoid COVID-19. So this video is all about what you can do for preventing COVID-19. During this time of heightened potential infection from COVID-19, favorably modulating the immune system and immune function can be an important strategy for not only reducing the chance of infection, but for potentially reducing the severity and the sequelae from the infection. So there are several steps that you can take to reduce your chances of being exposed to respiratory viruses and to boost your immunity in the event of any exposure. Since lifestyle factors have a large effect on the immune system, optimizing your lifestyle factors are of course excellent first steps. There are some common diet and lifestyle tips, which I'm sure that you've all heard from various different health professionals, and these are common, and they include eating a well-balanced diet, focusing on nutrient-rich fruits and vegetables, as well as healthy proteins, which are of course needed to support a healthy immune system, eliminating anti-inflammatory foods from the diet, such as gluten, refined carbohydrates, nightshades, nuts, legumes. Some cases even a low histamine, low FODMAP diet might be appropriate. Getting regular exercise. So just like a healthy diet, exercise is a pillar of health that can contribute to a strong immune system. So exercise improves circulation, and this is what allows the cells and components of the immune system to move through the body freely and do their job efficiently. Taking the time to relax and de-stress. Stress drives the production of cortisol and epinephrine, which are both known to diminish type 1 helper cells and natural killer cells. And of course, make sure to get plenty of sleep. As you're all probably aware, lack of sleep can adversely affect our immune system. This general lifestyle advice, I wanted you all to know that if this is not enough, if you are still continuing to suffer or are just not managing to bounce back into your normal self, then we have a carefully considered immune support strategy that helps complement these existing strategies. So we can really enhance the immune system in 5 key ways. So number 1 is ensuring optimal nutrient status to support the immune system. So this is by ensuring that you have the right amount of potassium, which can help maintain T cell function. Vitamin A, D, C, they're all essential to the healthy functioning of a number of biological processes and function. And zinc, which plays an important role in supporting the body's defense system, promoting healthy natural killer cells and T helper cells. Sometimes even quercetin might be appropriate to support cellular immune and cardiometabolic health. Number 2 is by encouraging natural killer cell activity for first line support. So we can actually promote this cell mediated immune response, including natural killer cell and macrophage activity, to enhance these natural defenses and mucosal health. So studies have shown that things like black currant seed oil and some sort of mushroom derived extracts, they can all support this. And specific strains of probiotics in combination with vitamin C, they've been shown in clinical trials to support upper respiratory tract health in adults. Number 3 is by supporting healthy activation of T helper cells to promote immunity and cell-mediated immune defenses. So this is where things like berberine come into play, which they are known to positively influence immune biomarkers that are related to cell and tissue health. Things like elderberry extract, which supports an upper respiratory tract as well, and it also supports their immune function. Number 4 is by maintaining cytokine balance. So this is with things like glutathione, which is a key component in the antioxidant system, and it protects the body from free radicals at a cellular level and enhances antioxidant activity also of things like vitamin C. N-acetylcysteine, so NAC, that's a key component of the antioxidant defense system, and curcumin, which has a long history to maintain healthy cell cycle function and provide important antioxidant defense. Furthermore, it supports the body's natural detoxification system and of course maintains healthy hepatic function. Number 5 is by promoting a healthy stress response for restoring the immune function. So stress management strategies such as deep breathing, journaling, meditation, along with these nutritional interventions, can help manage stress and support the immune system and immune function. There are some brilliant adaptogens out there, such as ashwagandha, rhodiola, ginseng, and they all support a healthy response to that occasional stress. So there you go, so many more ways to beat that fatigue that goes far beyond lifestyle. So if you feel that you're one who is struggling, please do get in touch with us and we can show you how to overcome this with ease. You might be starting to feel better gradually, and if it is gradually improving, then keep going. Don't forget that quality rest, routine and fun in your life is all important to support your recovery. But for those of you that aren't, don't worry, it can take several number of months and sometimes a year or more for people to fully recover from this post-viral fatigue. So remember that stress and worry uses energy as well, so give yourself time and be kind to yourself. So that's all from me for now. This is Dr. Gayatri working in partnership with you in mind to support your health, design personalised medicine so that you continue to thrive not only today but tomorrow and always. Bye now.